We've got a big warning tonight from doctors as more measles cases are hitting more than a dozen states.
And while none of those cases are in our state, representatives from the New Mexico Pediatric Society say it's on their radar.
Jacqueline Aragon joins us to share what she learned from doctors about why this disease is resurfacing so quickly right now. Jacqueline.
Yeah, I talked to Dr. Alex Vianovich, and she warned this possible comeback of measles is no joke. And if parents don't start vaccinating themselves and their kids, we will see more encounters of this spread.
A lot of parents say to me, well, my children don't need these vaccines because we don't see these diseases anymore, which, as we know now, is not true.
A new report Friday from the Center of Disease Control and Prevention says there are now at least 14 cases of measles across 16 states. The CDC and other health experts say, other than travel, the main cause is more and more people are refusing to get vaccinated.
There are a lot of families who worry about vaccine safety, and yet we know that this is an extremely safe and effective vaccine. The measles virus vaccine is combined with mumps and rubella, and that combination of the vaccine has been around since 1967.
This vaccine is typically given to children at the age of 12 months, meaning babies under that age are very susceptible to catching the virus, especially from those unvaccinated. Dr. Alex Vianovich, spokesperson for the New Mexico Pediatric Society, says kids become contagious before physically seeing the spots for measles, which makes the spreading of the virus easier. And the scary thing is,
months to years later, the infection can be reactivated in the spinal fluid, and so it affects the brain.
Dr. C saw that firsthand with an unvaccinated patient who she says handled the virus well at 5 months old, but later passed away at 14 when the virus returned. Dr. C says while there aren't any reported cases in New Mexico, we're not in the clear and warns it could hit our state hard.
One, we're an underserved state in terms of medical care. So getting rapid medical care to take care of these kids who get the measles virus is critical, and it's going to be a challenge.
Dr. C is urging folks to take care of our vulnerable population.
Keep them from getting, measles pneumonia, measles encephalitis, which is brain inflammation, and then, like I talked about, that later effect of measles, which can lead to a long, horrible death.
The 41 cases across the U.S. marks the largest in recent history of the virus at this time last year. Experts warn the country could face repeat of 2019's massive surge and worry that could threaten the U.S.'s status of having eliminated this virus. Now, back to you.
All right, Jacqueline, thanks for the update there from